Hello, I'm Dr. James Vogash, Master of Health and Longevity and creator of Modern Health Myths. And today we're going to talk about asthma and the fact that it might not be a respiratory problem at all. I mean, obviously it's a respiratory problem, but we have always looked at it as a problem with the immune system, and every medication we use to control asthma is designed to suppress and control the immune system. However, none of these drugs actually fix the problem. Otherwise, people would get over asthma, and you find that while some kids may grow out of asthma and some adults may, in general, the medications don't fix anything, they just allow you to manage it. The only one that doesn't necessarily control the immune system is the adrenergic pathway, so like the ones that affect the adrenaline pathways and allow the bronchodilators that allow the airways to open up. But again, none of those fix the problem because maybe the problem isn't actually the immune system. And this boils down to a concept that I have talked about multiple times, and it has to do with our microbiome, the bacteria, and not just bacteria, but viruses and others, but in general, the bacteria that live within us, called our microbiome. And we used to think of the gut microbiome, but now we realize that we have microbiomes everywhere, even on our skin, but certainly in the respiratory tract. So think mouth, sinus, pharynx, nasopharynx, and down into the trachea and the lungs. We have bacteria that grow there. And there happens to be a particular bacteria that has been associated with asthma, and this one falls under the category, the class of Moraxella, might not be pronouncing that right, but this particular bacteria has been shown to be associated with asthma. But one of the things we know of is that other conditions, like autoimmune conditions like Crohn's disease or ulcerative colitis in the gut, that when the immune system is developing, when we're our infants and toddlers, our immune system is learning to play well with the bacteria that line our surface. However, if these bacteria are not present, if an infant or toddler has been given antibiotics, when the immune system finally meets those bacteria, it now becomes a clash rather than a friendship. And that's why we see drastic increases in autoimmune conditions like Crohn's and ulcerative colitis when infants and toddlers are given antibiotics early in life. Well, the same thing is highly likely to be happening with asthma. And so instead of thinking of suppressing the immune system, we need to learn how to get our immune system to play well. But sometimes that starts way back in the toddler and infant stages, which brings us to this particular study that looked at infants. There was a group of, they found a little over 700 kids. They found that 8% of these kids between 2 months and 2 years ended up developing asthma. But what was interesting is these kids who had a lower level of Moraxella had a 200, what was it, 200, a little over 274% higher risk of developing asthma. Remember, we said that this bacteria actually increases the risk of asthma as an adult. But what if antibiotics as a child or an infant or toddler kills off the bacteria that we want to be there, and the immune system never learns to play? Instead, its first exposure becomes a battle. And now we get the symptoms associated with asthma, where asthma is really almost a dysbiosis of the respiratory tract. This is not something that most pulmonologists have embraced, but the research continues to support the idea that we should work on our microbiome from birth, but certainly as we age, to better manage conditions like asthma. This also means that antibiotics, which are very commonly given to asthmatic patients, probably make the condition worse in the long run and certainly do nothing to fix the problem. So as always, I will post a link to this particular study in the comment section. Make sure you like this video, share it with somebody you know who has asthma and wants to know how to better control it, and subscribe to the channel.